Alrighty, good afternoon, everybody. My name is Dylan Kurian.
I'm Lauren Angus. I'm Namita Mahajan. I'm Cindy Lay.
I'm Harper Siegel.
I'm Christina Yee, and this is Revitalized Rivers, an upstream approach to controlling schistosomiasis in Senegal. The Diama Dam was constructed on the Senegal River in order to increase water access and usage for agricultural and domestic tasks. However, the construction of the dam decreased water salinity, which led to the eradication of native river ponds that preyed on snails, the secondary host of schistosomiasis. This led to a surge in infection rates as snail populations flourished alongside slow-moving freshwaters. We have selected a total of 18 villages, 8 river-based and 8 lake-based. These villages have high transmission rates due to their dependency and proximity on infected waters, and they represent the most vulnerable populations with restricted healthcare access to clinics and hospitals.
Current intervention of mass drug administration alone proves to be an unsustainable solution for schistosomiasis control and reinfection. Our 5-pronged plan addresses these limitations by integrating bio-preventative measures, climate change resistance, water infrastructure/hygiene, alongside community and care. The interdisciplinary plan maximizes the impact of our pilot program while using resources efficiently. Centered around community, the beginning stages of the program are dedicated to the acclimation and building trust with community across the board.
Let's start with Eco 1, biopreventative measures. To begin, research has shown that the total area of water and area of vegetation are the 2 best indicators of human infection. Thus, precision mapping with affordable and accessible technology like drone imagery, machine learning, and geographic information systems will allow us to identify areas of high transmission with over 95% accuracy. We will also be adopting the award-winning Citizen Science Open Access Data Platform, which allows for the widespread sharing of up-to-date information we believe that an informed public is a powerful public. In these identified high-risk areas, we will implement vegetation removal and reintroduce native river ponds to control the snail population. Areas with vegetation removal have infection rates almost 1.5 times lower than control areas. Senegalese workers wearing PPE will manually remove this vegetation at water access points, composting it to use for fertilizer to boost private crop production and as cost-effective livestock feed, which is up to 179 times cheaper than traditional options. This economic incentive has the potential to break poverty-driven disease traps. The reintroduction of prawns restores natural predator-prey relationships that the Diama Dam initially compromised. The reintroducing of prawns reduces prevalence of infected snails by 80% and infected humans by 18%. We will achieve this by subcontracting with Stanford University and Washington U, who have already well-established research infrastructure in Senegal. With their help, we will expand across the 16 target villages and equip local stakeholders with institutional knowledge about project management. Our next prong, Eco 2, details climate change resilience. We plan to integrate climate-smart agriculture education into community meetings. We know that women are mainly responsible for the agricultural livelihoods of crop production, yet are left out of key decision-making processes. We plan to collaborate with women farmers and other community leaders to spread awareness of climate-smart agriculture options that are available within their individual agro-eco zones. Each year, every village will receive $14,000 to implement climate-resilient agricultural practices that best suit their region. For example, in, let's say, a drier predicted year, farmers might decide to substitute maize for soybeans because of their higher drought tolerance. Project leads will spearhead this piece of education, but we grant full financial autonomy to each village as they know their land best. Multiple NGOs have also established a climate warning system via radio broadcasting in local languages. We will adopt this infrastructure to create a domino effect of well-informed and prepared communities.
Our 3rd prong will introduce a suite of solutions to promote safe water contact and hygiene practices. Studies showed that the use of pit latrines are the easiest way to interrupt the life cycle of the parasite. However, the modern-day pit latrine seen on the very left has been largely rejected by community members. On the other hand, the more utilitarian latrines designed and built by locals had a significantly higher respect and rate of use, which is seen in the middle of the 3 images. Our plan is to provide funds and educational resources for the community members to be directly involved in the design and construction of 1 well and 30 pit latrines per village, which we will also be financing. In order to maintain the cleanliness of latrines and upkeep wells, we'll offer regular subsidies to jumpstart local businesses around water infrastructure upkeep. To further capitalize on the high local knowledge of schistosomiasis, we'll set aside a portion of the weekly meetings to discuss community knowledge, such as optimal times to enter the water and former policy ideas which are no longer in use but have been proven effective.
For prong 4, we have established 2 methods to decrease transmission rates and bolster local healthcare. First, our team will distribute praziquantel through a mobile pharmacy system we have developed. Distribution is going to occur every 6 months across all 16 villages, but administration will be determined by the relative rate of transmission in each community. Teachers, religious leaders, and community elders will be educated to administer praziquantel at schools, mosques, and other community centers. However, as our plan progresses and transmission rates decrease, drug distribution quantities will follow. We know curative medicine alone does not fill the gaps in the delivery of care, and health systems themselves must be strengthened. Villages with reasonable access to clinics will be allotted $3,750 USD annually to cover employing 2 new staff members and finance other varying needs. For the 4 lakeside villages that we have determined to not have sufficient proximity to a clinic, which is indicated on the map with the star, these yearly funds will be compiled to build a new clinic to ensure equitable access to quality healthcare for all.
The 5th part of our plan is community and care, which revolves around education, particularly understanding health beliefs across different age groups. For this reason, we will learn Senegalese children's views and beliefs on schistosomiasis for the first 6 months. We plan on implementing education through a cascade effect led by community leaders, which include religious leaders and teachers. With this, they are encouraged to educate their followers and students, and a past study has shown that students act as links between the families and the communities by retransmitting knowledge and generating large change overall. Community leaders will be given the deliverable of a picture book to distribute. This will be done at a rate of 250 books per village, ensuring that each household receives at least one. A picture book format was chosen because it is able to appeal to a wider audience regardless of literacy level. Contents of the book would entail depictions of schistosomiasis, how it's spread, and how it can be prevented, and this all follows a past successful model. Also, stickers will be distributed to engage children further and encourage discussions on schistosomiasis. We will also be emphasizing the empowerment of women. Women play a fairly traditional role in Senegal, and by incorporating teachers who are 85% female as leaders in the educational cascade, we hope to promote positive cultural change. Women are at higher risk because urogenital schistosomiasis can further develop into HIV/AIDS, and we want to promote women taking charge of their bodily autonomy and overall empowering them.
Our timeline begins with the first 6 months being an acclimation period to establish trust with locals within the community. Baseline evaluations of the number of snails, prevalence of schistosomiasis, vegetation removal will be taken through human sampling and drone surveillance. Qualitative evaluations will be conducted through surveys that assess emotions, attitudes, and thoughts regarding schistosomiasis. Quarterly assessments will be conducted through the rest of the project. In year 1, we will be contacting the NGOs. Weekly meetings and construction of latrines and wells will also begin. In year 2, vegetation removal will begin and continue for the rest of the project. Weekly meetings are conducted to discuss climate change resistance and hygiene. Drug administration and distribution will start and continue 6 months for the full duration of intervention. Along with drug distribution, education material will be given out to the communities in year 2. Upkeep of the wells and latrines and ponds will begin and continue for the remaining years. In year 3, the clinic construction will begin. Our team members will only go to the project meetings bi-weekly to decrease our presence. In year 4, the health clinic is established and team members will only attend the community meetings monthly. Lastly, in year 5, our team members will attend the project meetings quarterly and perform final samplings during the 4th quarter. Our goals for intervention are to increase self-reported climate change preparedness, schistosomiasis educational awareness, and latrine usage by 20%, a decrease in prevalence of infected snails by 70%, and a decrease in transmission rates yearly of 10% to reach an overall 61% final transmission rate at the end of 5 years. The majority of our funds are allocated towards climate change resistance, curative measure, and employment cost. Bio-preventative measures are an essential part of ECO5. However, we save a significant amount of money by contracting with local NGOs and leveraging already existing and successful infrastructures. Employment is a large portion of our budget, as we are employing Senegalese people to give fair wages and economic advantages. Furthermore, we are employing 8 project managers for prongs, evaluations, and sampling. Even though community and care only makes up 0.2% of the budget, it is still a major part of our plan. It is relatively inexpensive because it doesn't require upkeep and can be spread by word of mouth. Lastly, we built in $100,000 as an incidental fund in travel and other.
We have critically examined our plan and have determined several of the underlying strengths, weaknesses, opportunities, and threats. Displayed on screen is a SWOT analysis detailing how we identified and characterized these aspects of our intervention. Our primary strength is that we placed a heavy emphasis on keeping our plan interdisciplinary, although we were held back by several constraints, such as personnel limitations. When evaluating external factors, it can be seen that by cooperating with outside organizations, it is possible to benefit heavily, while also leaving us exposed to developing a dependency on these organizations.
And now thinking ahead, we hope that the success of ECO5 will accumulate data-driven, evidence-based support for the reintegration of native river prawns across the Senegal River Basin. Overwhelming public support and citizens advocacy would support Senegal, Mali, and Mauritania to develop the political will necessary to develop infrastructure change within the dam itself. A fish ladder, depicted in the middle image, is a common bypass for aquatic life, such as prawns, to breed in brackish water and migrate down the river, restoring ecological balance across the basin. Our partner, Stanford University, already has ladder building integrated in their long-range sustainability plan. Coupled with infrequent drug administration, education, and community engagement, a fish ladder is the ultimate upstream intervention that we are working towards. Thank you.
We did it for 1 minute. Okay, we will have next work. We'll have 1 minute, or we'll have 10 minutes for questions from the judge.
Thank you very much for your presentation. It was very well done, very organized, visually pleasing. What I especially appreciated about it was that you acknowledged the work that's already been going on, and you talked about people that have been doing this. So I think that's really important, that instead of, reinventing anew, that you acknowledge what is happening and what is working. Also, I think you really pay attention to community input and are thinking about things like maintaining latrines, or how do we maintain this, because that is correct, that people stop using latrines pretty quickly. Until that you've done this research, it really shows that you've really seen other projects and what has worked and what hasn't. And I think that's essential for designing anything new or just enhancing what has already been done. So I congratulate you on that. I think that you've really taken a lot into account already as far as community engagement and this idea of empowering women and recognizing that most teachers are women, and how that they have a lot of influence. So it sounds like the fish ladder is sort of the key intervention that you're interested in. And I do know that other groups that have worked on prawn, cultivation, one of the problems has been that prawns don't really stay where they were put. They sort of escape, and I'm not sure, maybe they're going to more brackish water or what the reasons are. So that's been a problem. How do you keep the prawns in the place that you need them to eat the snails, for one? So that's
yeah. Okay, so if we could go to the appendix slide, keep going. Keep going. Yeah, right there. Okay, so this outlines the methods that were like described basically in the main studies that we looked at for prawn reintroduction. In terms of like this pilot study, what the research studies did is that they outlined a certain like square footage area of the water access points, and they use different materials such as like mesh, like netting and sandbags to contain the water access points. And so prawns were reintroduced into that area, and that's also where like the sampling was taking place. That was the like a restricted area where children would play in, or you know, like that was your main area of water access.
Okay.
In terms of the fish ladder, that would eliminate the need to sort of like target an area of reach anyways. This is like truly the most upstream that you can get, because the dam was the initial issue of you know, like eradicating the native prawns. If you allow an area of crossing for the prawns, you restore that predator-prey relationship that I had mentioned earlier. Studies have shown right now that actually there is a huge abundance of snails, or of prawns, that are pushed right up against the dam.
Oh, really?
Yeah, and they're looking for somewhere to go because it's in their natural, it's like an annual migration that they do. It's the same way that like salmon will swim upstream to mate and things like that. Yes, so the prawns require brackish water to mate and to lay their larvae, but they're freshwater snails, so they're looking to continue their lifespan past the dam. So that fish ladder would allow them to cross, and it's the engineering is designed for the way that they move, like the kinetics of the prawn, literally like they hop and things like that. So after they are reintegrated into the river, when they're at their like juvenile stage is when they actually consume the most snails. That's when I think their body mass, they eat like up to 3 times their body weight in snails, because they need that uptake of calcium. And then afterwards they will grow in the river to like normal body size. They're actually also like a native delicacy, so it provides an additional economic incentive. When the dam was built, it also like really heavily like the fishing community suffered. There was an entire prawn fishery economy that sort of fell apart when the dam was constructed. That fish ladder would allow for the prawns to come back into the river, and like the economic system coupled with the ecological system would flourish.
Thank you. Great answer. Thank you.
Well, thank you. First of all, I totally agree with my fellow judge. Excellent work, excellent presentation, clean presentation. Very, you brought it well. I don't have a lot of questions. Considering my background, I'm at the Department of Environmental and Occupational Health, and one of my key areas is climate, especially food security and safety. You mentioned climate smart agriculture, so I may have missed it. How does it relate with the current agricultural practices?
Yeah, I'll take this one as well. So if you go, keep going, further down, yeah. Okay, we can start here. Okay, so Senegal is at definitely high risk for climate volatility, just because it is, so they suffer from a lot of poverty, but they're not one of the nations that are contributing the most to climate change. We know that global climate change is produced by Western nations, and like low income Black and brown neighborhoods, like they suffer most. And so part of increasing their climate resilience is empowering them with the education in order to adapt in the ways that they see fit. So we know that there are 6 different agroeco zones. They're listed there on the board. And within those zones, their agricultural like prize crop is different. There's also a lot of like political differences within each zone. They operate very self-autonomously. So allowing that leeway for them to decide what is best, I think, is really where we should go. That's also why we've allotted the climate fund, the $14,000 a year. It's for them to do with what they please. If they think like a crop like cycling is the best option, or maybe like a drip irrigation system, or they want to use the composting for organic fertilizer, it's up to them. It's just that we know that the climate change is like a very volatile cycle, and so ideally preparing them for climate disasters, whether that's short-term or long-term, would help them stay resilient in an economic sense and an ecological one.
A really important aspect. And I think I will look differently at prawns now. Thank you.